Hello, I'm Rex McKinney. I serve as president of Decatur County Memorial Hospital. We'd like to take a few moments today to describe what Decatur County Memorial Hospital is doing for our community during the COVID-19 emergency. Today, we have several organizational leaders to explain the current status at Decatur County Memorial Hospital and the support we're providing our community. We have Cathy Wichman, our Chief Nursing Officer, Dr. Tom Ferry, Pulmonary and Critical Care Intensivist, and Dr. Wayne Perry, who serves as our Chief of Staff. I'd like to provide a summary over the past few days of how our team has supported our community. On February 27th, our internal team met to begin planning for the COVID-19 emergency. On March 6th, our emergency operations team within Decatur County Memorial Hospital began meeting routinely to prepare for the emergency. Followed by, on March 13th, our president declared a national emergency. Our team has been well prepared and organized for the declaration of the national emergency. On March 16th, we formally instituted our incident command structure, where there's 24/7 coverage and support for the incident command and support of our community. We are monitoring this situation hourly. Our current state: since we've implemented our incident command structure, we have assumed that the COVID-19 virus is in our community, and we continue to behave that way today. We have received significant support from our community, and our entire team is energized to ensure that our community needs are met during this crisis. In response to the needs of our community, we have instituted new services. We have instituted video visits to ensure patients are supported remotely and ensure that their care is provided by their provider. We've also instituted a cough and fever clinic. You can access care and request consultation by using 812-222-DOCS. Over the weekend, an extraordinary event occurred on our campus. Some unknown person placed a Heroes Work Here sign in our yard, and that is exactly what's going on. Our entire team is energized and enthusiastic about caring for our community, and our core values are alive and well today in the midst of this crisis. Our value of community, quality, integrity, and compassion is very visible today. At this time, I'd like to introduce Cathy Wichman, who serves as our Chief Nursing Officer.
Thank you, Rex. As you can see, we're very, very well prepared to meet the needs the community has at this time. And I'd like to just take a moment to put everyone at ease. We've been had our eye on the ball since the end of February. We enacted the emergency operation plan and have really just not missed a beat since. And that's just really a testimony to the work of the team here at DCMH, and we're just really proud of the efforts. And so some of the things that we've done here recently in the last few days and hours is think about our number one priority, and that's you, our community. We want to make sure that you're safe. And so we've implemented some screening tools and some visitor restrictions to do that. And so I want to talk a little bit about that with you right now. The screening implementation occurred last week. Many of you might have seen some tents go up at our campus location, so at our clinics and then our main hospital campus. We limited our access to our facilities to those entrances so that we could talk to you a little bit about your risk for exposure and the symptoms that you might be having. And so you've probably, if you haven't heard, that's also available on the phone line that Rex mentioned, the 812-222-DOCS, and then also the hotline number that's available, which, by the way, we've partnered with the Department of Health here to man those 24 hours a day with a trained nursing staff, to really just give you some comfort in knowing that we're going to meet that need and answer your questions or concerns in real time whenever you might have that happen. Along that line, if you are needing to come into the hospital for something, we will have to limit the number of visitors that are able to come with you. And I know that that sounds very different than what we've said in the past, and it really truly is to keep you safe and to keep our staff safe. So on a case-by-case basis, we'll be looking at the visitor restrictions. You would need to access either through those numbers that I mentioned or our social media platform or our website to determine what makes sense. Those guidelines will be listed there and kept current and up to date. The other thing I want to talk to you a little bit about is why. So when we engage the community unnecessarily right now, given the circumstances, it's taking some of our valuable resources, like what you may have heard probably in social media or on the news right now, PPE, which is our personal protective equipment. That's our gowns, our masks, our gloves, our goggles, the things that really we need to keep ourselves safe while we care for the critically ill with the virus. So that's one of the reasons why we're doing the visitor restrictions, is so that we can minimize your exposure and also our need to utilize critical supplies. One of the things I wanted to acknowledge, and Rex kind of already alluded to that, was the amazing support of our community when we've had a call out for support. We've had support from the from meals to the signs. We've had local businesses donate a lot of the supplies I mentioned, the PPE that I mentioned, and for that I cannot tell you the way that it has made our staff feel very cared for, very loved, which is what we try to do for you every day. The next step I want to talk to you about is, what do you do if you don't know? I want to remind you, if you don't know, call the provider lines that we've given you. Look on our website. Look to the social media resources that we've offered to you. But if you want to know what can I do personally, individually today, the number one thing you can do is stay home. Stay home. Make sure that you're washing your hands, that you're using good respiratory hygiene, that if you're sick in any way and you're at home, making sure that you're isolating yourself from your family members, not sharing common space, not eating in the same areas. And if you're sharing restrooms, like many of us have to do in our homes, make sure you're cleaning those down between each use so that everybody in your home is kept safe. Again, if you have questions, we're here for you, and we want to let you know that we are very well prepared to care for you in any need that you have. The entry to our hospital doesn't change. If you have a life and limb emergency, we want you to call 911 and follow that process as you normally would, and you will get the same great care you've always gotten from us. And with that, I'd like to take a time to introduce you to Dr. Ferry, and he will take over from here.
Thank you, Kathy. My name is Dr. Tom Ferry, and I'm one of the pulmonary critical care staff physicians here at Decatur County Memorial Hospital. And I'd like to certainly echo everyone's comments earlier as to the tremendous support and kudos to everyone both in the community as well as our hospital staff and outreach community for their gallant efforts at this amazing turn of events. Obviously, this is a unique challenge facing our community and our country and the world. And so obviously we must draw close and pull together as all our resources and common sense collectively. Certainly, I think a lot of concerns or questions. If I get sick, I'd like to make a few comments to expand on Kathy's comments. Certainly, if you are acutely ill and having significant shortness of breath, one of the main symptoms of the COVID virus are just general flu-like symptoms. Majority of people, 85% of people who are infected with the COVID virus have normal flu-like symptoms, and not to minimize those symptoms because you can feel quite miserable when you have the flu. But typically it's flu-like symptoms of the fatigue, aches, and fevers. But it becomes more serious if you start having respiratory compromise. So if you start having shortness of breath beyond the cough, I think those are the telltale signs for you or one of your family members to call one of the numbers provided and say, hey, I'm having concerns. I may have the COVID virus. What do I do? And obviously, if you acutely are having significant shortness of breath or unrelenting cough that you think is extreme, I think I would encourage you, we need to call 911 and or call the hospital. Don't wait. And I think now, again, you may then be instructed upon further triage and evaluation to say, stay at home, do X, Y, and Z. But I think it's coordinate. But should you develop significant problems, we are prepared here at Decatur County Memorial Hospital to meet your needs as it relates to COVID virus and others. We have a full complement of respiratory therapists. We have ventilators and all the important equipment needed should any of our community members become infected with the COVID virus and develop respiratory problems. We do have ventilators, and we are trained and able to respond. Our emergency room staff has already seen, so as Rex or Mr. McKinney mentioned, COVID virus is here in our community. We have had cases, and we have already been responding to those patients in need. And certainly, if we need to provide care for you, we are prepared to do that. Should you have respiratory compromise, some people say, well, if I might end up on a ventilator, should I go to Indianapolis? It's a long way to Indianapolis, and we can provide that care. And unfortunately, people could get into trouble driving to Indianapolis with their respiratory symptoms. And importantly, we can meet those respiratory care needs here. One of the questions is, do we have the resources if I do develop the COVID virus? What do I do? I mean, obviously, to seek medical attention. Should you need pharmacologic therapy? Right now, there's still debate. It's an unproven. There's what's called anecdotal or observational data that suggests that some of the newer medications, what's called Zithromax and Plaquenil, which is a medicine that's sometimes used for other medical conditions. We have an ample supply of that medication if we need it. It's not appropriate for everyone. And so if you should come down with what you think are COVID symptoms and contact your primary care physician, they are not necessarily going to be saying, well, here's your prescription for azithromycin and Plaquenil. We need to reserve those medications for certain population of patients who are greatest at risk for needing those medications. However, having said that, should that be one of your loved ones, we have ample supply to make sure that we are able to respond to that. And so I think we are clearly well poised. We have a full complement of critical care staff, emergency room, respiratory therapy to meet any of your hospital care needs. And most importantly, before I turn over the podium to Dr. Perry, our Chief Medical Officer, importantly, should you have other medical conditions, don't delay to seek medical attention for your diabetic ulcer or diabetes control, because obviously we have enough problems as it is dealing with COVID. We don't want to have other by not attending to your other general medical needs, in which case take advantage of the telemedicine and other avenues that we have available. And with that, Dr. Perry, our Chief Medical Officer.
Thanks, Dr. Ferry. Greatly appreciate it. That's very important clinical information from Dr. Ferry. Again, my name is Dr. Wayne Perry. I am the Chief of Staff, privileged to be the Chief of Staff here at Decatur County Memorial Hospital. Right now, as Dr. Ferry and the others, Mr. McKinney and Cathy Wichman have alluded to, we're facing some great challenges right now. Individually, from our hospital standpoint, community standpoint, county standpoint, state, and a planetary standpoint, we're here to meet those challenges. I've had the fortune of being involved in the field of medicine for about 34 years now. Unfortunately, this represents the greatest singular threat to public health and safety that I've ever seen, probably the greatest singular threat that we've seen over the last 100 years or so. Fortunately for us here, we've got excellent leadership. We've got great leadership. I'm very proud to be a part of this organization and work with these great people. We are prepared, as you can tell by the previous discussions. Our staff is prepared, our providers are prepared and well trained, our nurses, our nurse practitioners, our ancillary services, our environmental services, our dietary services, everyone is prepared to meet these needs. We are also looking to switch some of our models for care, as we've talked about before, switching to telemedicine. It's very important. We want to continue to provide the care that you need, at the same time minimizing your risk. Minimizing the risk to our staff. These are things that we're doing, we're going to do, and we're going to do those duties very, very well. We talked about resources. Resources is a topic you've heard of a lot, certainly. We've got ample resources right now, but with anything, resources are finite. So we want to try and protect you and protect those resources as we move forward. So what can you do? Well, one thing is realize the severity of this illness. This can produce a very, very severe acute respiratory illness, as Dr. Ferry alluded to. It is highly infectious. This virus infects at a rate at least 10 times greater than most other viruses. It has an affinity, otherwise a binding to the human cells, 10 times greater than most other viruses. Because of that, it has spread rapidly, quickly throughout the globe. If you think about it, 3 months ago, there were just a few hundred cases isolated to one city. Now it is worldwide. So it is very, very severe. I want to illustrate one thing, and that's a simple formula. Well, I know mathematics not always so simple. A lot of people think mathematics isn't important. Well, I'm here to tell you it is. So I'm going to give you a simple formula to go by and everything. All of the local mathematics teachers are right now standing up and applauding me in isolation. The formula is this. Your risk of infection is equal to the probability of getting infected with a contact, the duration of that infectivity, how long is it going to last, and your duration of exposure, how long are you going to be around that person, multiplied by your number of contacts. So if your number of contacts is 0, any number times 0 equals 0, your risk will be 0. Okay? So that's why it's very important to socially isolate. If you're around one person, that's your baseline. If you're around 10 people, you've increased your risk tenfold. So it's very important. Try to isolate. It's very, very important for us. At this point, one of my other recommendations is consider yourself and everyone around you is potentially infected right now. Take the time, isolate, avoid others as much as you can, at the same time supporting one another. Again, key note, in order to take care of yourself, take care of your loved ones, take care of your family members, help protect us, please stay home. We are prepared, we are determined to deal with this, and we will. And with that, I'm going to turn it over to Mr. McKinney for some closing statements.
Thank you all for your leadership. I'd like to remind you that Decatur County Memorial Hospital is dedicated to serving this community during this crisis. I want to remind the community that we continue to have pharmacy services in place, and we do home delivery as well as drive-up service. Those services are fully available to our community. For pharmacy delivery, you can contact 812-663-1250. And as a reminder, the hotline number is 812-560-5450. And for a patient appointment for one of our dedicated providers, 812-222-DOCS. And remember, there's plenty of resources on www.dcmh.net. I'd like to close by saying thank you to our community. There's extraordinary work and great patient care going on each day at Decatur County Memorial Hospital. We have an extraordinary medical staff and a complement of providers that are dedicated to meeting all your clinical needs during this crisis. Our staff are truly heroes. It is occurring today, and I'm confident it's going to continue for another 100 years in our community. It's truly extraordinary work that is occurring. Over the coming days and possibly weeks, we are going to continue collaborating with a variety of resources to ensure our community is kept safe. We will continue collaborating with our county leadership and county officials, as well as the Board of Health. We are also in close contact with our emergency response team here in Decatur County and the region. We are also working closely with state and national resources to ensure that we have the latest information and are implementing the latest best practices to treat this emergency. Again, thank you to our community, and thank you to all of our DCMH team members who are so dedicated in serving our community. Thank you.